Hello everyone, welcome to Trial Optima. I'm Ali Sheikh. Today I will walk you through the phase 2 clinical trial design and evaluating the drug AAA for treating the mild to moderate COVID-19 project. Okay, so the study is a double-blind, randomized, and placebo-controlled, a gold standard in clinical research. So this is a basic introduction of the project which I'm going to introduce in this Python programming. Okay, let's brief about this clinical project. So this trial enrolled about 275 participants with the 250 ultimately randomized. Okay, it was conducted across multiple sites and lasted 33 days, including the screening period. Participants were randomized to receive either active drug, okay, active drug versus referred to as a AAA versus placebo. Okay, this is a completely double blind, which means both patients and the sponsor doesn't know, or maybe the physician they don't have this information. Okay, this is a randomized study. Okay, then the objectives of this study project, the primary goal was to assess whether AAA improves clinical recovery by day 14. Okay, so active drug improves the recovery up by day 14, and the secondary objective included reducing the hospitalizations and improving the symptom resolution. And exploratory goals focus on viral load, antibodies, and symptoms timelines. Okay, then when you come to the clinical recovery criteria, so to be considered clinically recovered, a participant must have temperature 37.7 degrees centigrade or less, a respiratory of 24 or fewer breaths per minute, no shortness of breath, and only mild and no cough, and hospitalization or loss to follow was considered be failure. Okay. Okay, so here we have in key inclusion exclusion criteria. So the key inclusion criteria were adult 18 years or older with a positive RT-PCR test and symptoms starting with 7 days. Key exclusion included G6PD deficiency, severe disease, prior use of experimental drugs, and certain health condition like pregnancy, psychosis. So these are the main two criteria in order to keep those patients into the study. Okay. So when you come to the treatment and dosing, the participant received 200 milligram of active drugs in the day 1, 2, 3, and 10, administered as 200 mg doses. Okay, and the placebo group followed an identical schedule. The trial was double blinded with the patients satisfied by site. Okay, they have double blinded study. Then when you come to the study procedures and visits, screening occurred up to 4 days before day 1. Patients were randomized, okay, given medications and set up with diaries, e-diary setup. Okay, the setup sample collection was done at home on day 5 and within the clinic, and telemedicine visits on day 14 and 28 respectively. Okay, so assessments will be: efficacy was evaluated through clinical symptom resolutions, the qPCR viral load and antibody levels tracked with e-diary logs. Safety was assessed via vital signs, adverse events, lab parameters, lab values like CRP, ALT, and AST. So based on these lab parameters, we have assessed these things. Okay. So next we'll be having a statistical design. The trial used intended treatment population flag per protocol and safety analysis populations. So the primary endpoint analyzed using 2:2, 2x2 contingency plus logistic regression, and the secondary endpoints were assessed using the chi-square and t-test. Okay, so sorry. And non-clinical safety summary: in animal models, the drug caused reversible lung and blood effects, but showed no cardiac and fertility risk. Okay, these findings supported moving to human trials with the proper monitoring. So the non-clinical is comes for the without human intervention. And the summary of non-clinical safety. So over 3,000 people received the drug for malaria prevention with good tolerance. Known side effects include GI upset, methylglobalaminide, and urticaria, rashes. Screening for G6PD deficiency is critical due to safety concerns. So these are the some of side effects we'll be considering for this particular drug. So the screening will be having they should not have any G6PD deficiency for that patient before taking into the trial. So the rationale of COVID-19 indications, in lab studies, active drug was 10 times more potent than hydroxychloroquine. It works for multiple stages of viral replication, achieves high concentration of lung tissues, making it a strong candidate for COVID-19 treatment. Okay. So when you come to the benefits versus risk, so active drug may provide early symptom and relief or reduce viral load with minimal safety concerns. Its interactions with the COVID-19 therapies is low. Okay, chances of cardiac side effects also small. So very minimal interference. And the key takeaways: the active drug could significantly improve the recovery in mild to moderate COVID-19. The study was well structured, robust, and featured multiple layers of safety and efficacy monitoring. So this is a kind of brief about COVID-19 project, the one we are going to continue with this project. So we'll be doing the end-to-end project involving the SDTM, ADAM, and TLF. So this is the COVID-19 for will be having this both safety and efficacy objectives. So hope you understand this part. So I'll also show you the protocol for a minute. Okay. So that's it. If you like this video, just subscribe, and we'll continue with the other videos next. Okay, let me show you the protocol. So this is the protocol I have. So this is a double-blind placebo control study to assess the efficacy and safety of oral active drug versus placebo in patient. So this was done in around 2021, sorry. So basically we are comparing with the two drugs, active medication with the placebo. So they have plenty of information present in this protocol. So when you finish this project, please send me the email for material4u0@gmail.com to request for the raw data. In that raw data documents, this protocol will also be involved. It will also be keep it inside the document folder. Okay, hope you understand and go through this project. Thank you so much for listening.